Welcome to today's Teledentistry Enhancing Patient Care During COVID and Beyond. My name is Romilly Douglas and I will be your moderator. Before I hand over to Elizabeth Ziemba, I have a few housekeeping items to cover about this presentation. First, today's web seminar is being recorded and will be made available by emails to all participants after the web seminar for further review and sharing. All participants will be muted during this web seminar, and at any time you may ask a question through the Ask a Question tab at the bottom of your player. If we don't get to your question during today, we will be sure to follow up afterwards. And the chat is on also, so please feel free to chat during this presentation and ask the questions as we go. So without any further delay, I'd like to start today's seminar by welcoming Elizabeth.
Thank you, Romilly, and welcome everyone. Good morning, good afternoon, good evening. We do have an international audience with us today. We have registrants from more than 29 countries and 5 continents. So my name is Elizabeth Ziemba, Regional Director for the US-based Office of Temos International Healthcare Accreditation. Our regional office is sponsoring a series of web seminars for dentists and dental professionals. Our topics are focused on the 3 pillars of Temos accreditation programs: improved clinical services, better business metrics, and a great patient experience. Before I introduce our speaker, I would like you to participate in a 1-question survey. This question is, how many of you currently offer virtual visits? So this is obviously for dental practices. Does your dental practice currently offer virtual visits? Yes or no? If you can just click on the appropriate answer, and then you need to scroll down a little bit farther on the page and click on Submit. I do realize that some of you are not dental practitioners, so unfortunately this question does not pertain to you, but for those of you who are providing dental services, does your dental practice currently offer virtual visits? Yes, no? Click Submit, and let us learn a little bit more about your dental services. So I see people still signing on, so okay. So let me introduce today's featured speaker, Ms. Jamie Collins, who is the Professional Education Manager at Mouthwatch. Mouthwatch is a global company that enhances understanding and improves the delivery of dental care through innovative software and related products. Ms. Collins has been in the dental field for over 20 years, both as a dental assistant and hygienist. In addition to clinical practice, Jamie is also a speaker, educator, teacher, and curriculum developer, as well as a writer who has contributed to multiple textbooks. With a passion for patient care, especially those with higher risk factors, Jamie enjoys sharing the tips and tricks of the dental profession through writing for various publications and speaking engagements like ours. We're delighted to have her with us today to educate us about teledentistry and answer your questions about using technology to improve the dental care experience. Please join me in welcoming Jamie Collins.
Wonderful. Thank you so much, Elizabeth. I appreciate it. As we said, we're going to be talking about the teledentistry and how to really enhance patient care, not only during COVID, but beyond. It's really become a mainstay. On this slide right here, you will find my email. Pretty simple, jamie@mouthwatch.com. If you do have questions, please feel free to reach out. As she did such a great introduction, I am just a dental nerd through and through. I am a hygienist, a speaker, work as a subject matter expert for various companies, in addition to writing for multiple publications, textbooks, And I do hold a certificate as a telehealth facilitator as well. I want to thank Temos for having us and hosting us. And again, full disclosure, I am an employee of Mouthwatch. We do have the Teledent software as well as our intraoral cameras. We are going to touch on a couple different topics. We're going to discuss the basic modalities of teledentistry and the necessary equipment. We're also going to identify how it has enhanced patient care and safety pre-COVID, during COVID, and hopefully we'll be able to talk post-COVID very soon. And then we're going to identify some of the workflows and business opportunities dental professionals are finding with teledentistry. So it's important to have a good understanding really on what teledentistry is. And so it's simply the telecommunication, communicating with technology, much as we are today, to deliver oral care or dental care, consultations, education, and using that interactive approach with audio and visual means. There are a couple key modalities that we use, one being synchronous. This is our live video call, face-to-face again as we are today, interactive. In the US, we have CDT codes we use for billing. This would be the D9995 code. And then there's also asynchronous. I like to think of the A as an absent. We don't have to be face-to-face to conduct this form of teledentistry. We may have an on-site provider who's capturing images and data and uploading the data that can then be sent to a dentist to review who's at a different site, make treatment plans and recommendations. In the US, again, this is a D9996 code, and I know we have a greatly vast international audience today, so those codes don't apply for you. With telehealth, we also have remote patient monitoring. This is a collection of the personal health and medical data that's from the patient and submitted to a healthcare provider at another location. These may be similar to a heart monitor or a diabetes monitor. And then the healthcare provider is able to monitor that, provide recommendations from an alternative site. And then we also have mobile health. You may see it as mHealth. And in this instance, we have public health or healthcare education through a mobile device, such as a smartphone. This can be apps that we have on our phone that collects health data that we either enter manually or automatically. These two modalities of telehealth are not widely used in dentistry. We're looking more at the synchronous and asynchronous abilities. It is important to know too, the originating site, this is where the patient is located. This is where they may be at, whether it's their home or a long-term care facility. So this is where they're located at versus the provider is located at the distant site. And so depending on the rules and regulations, you may not be able to provide care depending on where the patient is located at versus where the dental provider is located at. So look into your rules and regulations and know those. When we talk about teledentistry, there's a lot of misconceptions thinking that it's expensive and it's going to require the patient to have a lot of equipment. And that's actually really not true, because to conduct these visits, you need a device, whether it's a computer, smartphone, or tablet, and you need an internet connection. The patient is able to take images, and it's impressive what they can capture with a smartphone. and share through a secure and encrypted portal to their dental providers. They don't need to have an intraoral camera for the patient from their end of it. However, if you are using it with, say, a mobile hygienist who's going and capturing images, it would be beneficial to have a camera that they can use as well that can capture a little bit better quality images. Key points that we want to look with teledentistry. In the US, we have regulation called HIPAA, which really is protecting your patient's personal health information. So you always want to use a software platform for teledentistry that is secure and encrypted and will ensure that it covers those liability risks that you may have. It's also important to have a patient record, much as you would when your patient is in person and we see them in the office. We always make clinical notes, chart notes, about what was discussed, the diagnosis, next steps. Anything that we would do in person needs to be part of that record of a teledentistry or telehealth visit. And then I recommend highly using a technology that is cloud-based because you can access that from anywhere. You don't need to be on a server. So if I'm with my children at a game and I have a patient reach out, I can access it through that secure portal by us both logging in and through that notification. So also something that you'll get notifications and communication about as well. So very, very important to protect the patient's PHI and ensure that you're keeping your patient and your practice safe in both aspects. But how does teledentistry protect us? Because with COVID, it kind of opened our eyes. It opened our eyes on what we need to do and different ways to connect with our patients. A recent study that came out found that 46% of dentists said a drop in revenue for 2020 had been the #1 impact on their practice. 40% say the revenue and the cost will be the highest challenge for 2021 coming forward. 19% said the cost of PPE, our gloves, our masks, our gowns, have been the #1 impact on their practice compared to other ones with revenue. I know for us clinically, finding gloves and masks were next to impossible for a good part of 2020, even after dental practices came out of the lockdown and were able to resume. And when you could find them, the cost was tremendous compared to a year prior. However, 22% of dentists surveyed said COVID brought them new opportunities, including teledentistry, and really offered a way to expand their practice and how they are reaching their patients. 42% of adults in the US, this was done in the US, reported having delayed or avoided seeking dental care during the pandemic because of concerns of COVID-19 exposure. So not only is our cost of doing business much higher, but we had patients who were reluctant to return to the practice, and therefore dental conditions have worsened and become more of an emergent state moving on. One out of three of solo practitioners said they were not busy enough. They felt they had the capacity to be even busier. So teledentistry really provided an opportunity, as I said, and really opened the eyes of many dental practitioners who think dentistry is very much a hands-on profession, as we know it is. But we know that teledentistry reduces the risk of COVID-19 transmission, not only among our team members, but also our patient-centered dentist. It allows for that continuity of care during restrictions. Restrictions have been rolling, coming back and forth, going back into more stringent lockdowns or coming out of them, but it still ensures we can be in touch and provide that comfort and that diagnosis with patients as well. It's very useful if we have a little more of a higher incident of areas of COVID popping up as well. But it ensures a touch-free dental experience because all of your informed consent, your medical history, your patient assessment of need, any necessary paperwork or post-operative instructions can all be shared and discussed through teledentistry versus a face-to-face approach in office. And then many practices are using it to really evaluate the need and urgency for care with patients as well. So it may shorten the waiting time that patient is in office. Many dental practices are using it, especially for new patients, for example. When we're discussing the chief complaint or medical histories, they're connecting and doing it via teledentistry. So instead of being in their office for 2 hours, maybe they're there for only an hour for the hands-on clinical treatment. The rest can be done virtually. We're seeing benefits with elderly patients, especially those who struggle or have a difficult time finding a ride or getting to the dental practice physically. We're able to do those initial evaluations and consultations via teledentistry. And many times they don't actually need to come in. Emergency patients and screenings, children as well, being that initial face-to-face so they can see you're really human and not scary underneath all that PPE. And then medically complex patients who are very difficult and use multiple providers. Everybody can be looped in together to discuss the patient need. And you can coordinate the care, coordinate the needs of treatment with the correct provider that we need to have. HIPAA compliance for the US, regardless, no matter where you're located, you protect the patient's personal health information. You don't want to put it on a site that's going to be risky and could possibly be hacked and exposed. And by using teledentistry, again, we can prioritize and set those expectations for patients. So we're increasing the access to emergency care and urgent care based on the assessment of need. Do we need to see this patient in because they're swollen out to here with infection? Or do we need to get them medication or antibiotics to get that infection under control before we treat? Again, with limited gloves and masks, and the difficulty we find trying to locate those and get those, we don't need them when we're through a computer screen as we are now. And then we can set expectations. There's going to be less waiting time in the clinical dental office if we can do what is possible through teledentistry ahead of time. There's also more availability with teledentistry and more patient convenience. They're not trying to find time to take off of work and drive 20 or 30 minutes to your dental office when it can be done virtually and from home. And again, many patients were reluctant to return to dentistry. We're able to connect with them and they'll know that you're taking the necessary precautions to protect them when they do come in. But it does change your workflow a little bit because we have new protocols in how to schedule these patients, doing the pre-appointment face-to-face as we are now versus underneath all that extra gear that we now have to wear that previously we didn't don as much. And again, we can meet that backlog and we can prioritize the patient and really ensure that they're comfortable, that we as dental providers are protecting them as well as ourselves. And I often hear, Jamie, but what do patients think? What do patients think? And there's been some great studies come out from all over the world that they look at patient perspectives with teledentistry. And it really had a 97% satisfaction rate for patients with a virtual visit. 96% of those said they would do it again. And it looked at their accessibility, the ease of use, as well as did they feel their needs were met. And many of them actually commented they felt that they were understood and they can understand the provider, and they weren't interrupted or felt rushed as they were when they're in clinical. And of that, actually, 33% of all teledentistry encounters did not require an in-office visit afterwards. So patient experience, it reduces the travel time. They felt they had more engagement with their dental provider. They had a better understanding of their treatment plan presentation, and they could also include a decision maker with them. So if they had to talk to their spouse or another decision maker in the house, everybody could get together, create the value, and understand the needs that needed to be taken care of. So there was more clarity. And then simply the convenience of it. I've done telehealth visits myself over the past year, and I found personally I really like it because it saves time in my day. I'm able to do it from home. Recent trends we're seeing as well with pandemic related, there is a rapid increase by dental providers with teledentistry. The infection control, you can't catch anything from me through a screen, no matter what, and likewise from you as well. Pre-screening patients before they came in to make sure they were asymptomatic and reviewed the medical history as well. Legislative, many areas and locations are now allowing teledentistry, much in the way they do regular dentistry. If you're licensed to perform dentistry, you can do teledentistry as well. It fits underneath that scope of practice. For us in the US, third-party payers, insurance companies are reimbursing for it. And then it really helps with the workflow. A 30-minute appointment that you would have in office is now a 15-minute telehealth appointment, teledentistry appointment. So long-term, we're seeing behavior changes. Patients are demanding this now because they're finding the ease of use and the convenience of teledentistry. And then that digital workflow really opens up in the office how we're able to conduct business and really wrap up the end of our day as well. So we've shifted a lot of those preoperative and postoperative evaluations to teledentistry because they can easily be done and discussed and ensure the patient is following through or is healing as they should without actually having to put your hands in the mouth. Many studies are also coming out where they're looking at teledentistry as a way to improve healthcare in children. We know children are some of the most at-risk population that we do have. And so they're using it to reach out to kids who maybe would not get to a dental office otherwise. So let's talk a little bit about the workflow and the opportunity teledentistry will bring to your practice as well. So teledentistry in private dental practices, we would see everything from mobile dentistry programs where maybe the dentist or the hygienist would go to an off-site area to do it. We would see extended dental hygiene hours where the hygienist can practice without the dentist in the office. Or a dentist could supervise multiple sites or practices. We do have areas where a hygienist just has to collaborate with the dentist, but does not have to work underneath their supervision per se. So this was a way to do it. Group practices, again, we may have offsite preventative care going out. We may have specialty providers, such as an oral surgeon or a periodontist, that goes to various locations. They now have access to the data and information through teledentistry and can be reached at any given point. Outreach efforts to some of our most at-risk communities, whether it need to be camps or villages. We've had this used all throughout the world in different aspects to reach some of those who can't get to care. Public health. So we've had healthcare providers going into schools or long-term care facilities, taking care of the elderly, doing screenings, or really those rural or hard to get to places as well, to be able to reach that patient population. Medical dental collaboration, hospitals and emergency rooms, urgent care clinics, pediatricians when children come in for their well child checkup, at year 1, at year 2, the medical provider is able to capture images and screen and refer that child to a dental home, if you will, for care. So we're catching those early childhood caries sooner. And then collaboration between referrals to specialists, to coordinating care for complex patients. And then we're also seeing it heavily in education and curriculum. So dental schools and dental hygiene schools and education programs are teaching it, and they're able to use teledentistry to supervise their students and really focusing on having that hands-on touch, but improving education. Another workflow that we see often is in-office teledentistry. Because we have to maybe have our hygienist working and then have the dentist come in and do a check, the dentist is getting up from his or her chair that they're working on a patient, taking off all of their protective equipment, putting on new protective equipment for a 5-minute hygiene check, discarding that, and going back to their chair and doing it again. And if you have more than one hygienist, this can happen a couple times an hour. So the hygienists are capturing the images and any relevant data with that patient, and then releasing the patient to go on about their day. And the dentist is later able to evaluate, treatment plan, diagnose, and reach out through teledentistry to the patient to discuss the needs if that's what is indicated. Again, care team and collaboration. This may be where a dentist is overseeing multiple younger dentists or associate dentists as well. And they can all come together and review patient charts, especially complicated cases. And then patients can be looped into those consultations to ensure everybody is in the same understanding of the treatment needs. Home health and mobile dentistry, we see this often where a dental hygienist is able to go in and offer care in the patient's home or long-term care facility to the elderly, for instance, and stay connected with the dentist for the evaluation. This will be using an intraoral camera as well. And then the dentist is able to decide if there's treatment indicated, and at that point make arrangements for the patient to come into the clinic. So it's meeting the patient needs. It's also saving on trying to transition them and coordinating schedules to get them to the clinic to be able to do so. So it really meets the best of both worlds in this aspect. And then medical and dental collaboration. This is a part that I think as dental and medical communities were lacking. We're starting to come together more often and to look at the mouth is connected to the rest of the body. That seems to be a misconception for many. But medical clinic and dental clinic referrals. So many times, especially in rural or outlying areas, getting into a dentist is difficult. And so what we find is they wait until the pain is unbearable and they end up going to the emergency department or an urgent care department because of it. So now these rural clinics are able to triage and screen these dental patients with dental issues and then send them to the dentist from there, or the dentist can make the diagnosis via teledentistry, and then that patient gets care sooner. And so the patient's connected to the clinic directly for an appointment, because many of them they find is they say, you need to go find a dentist, but then it's difficult. They don't know where to turn or what dentist to find. So it's making that connection. And as we well know as dental providers, there are many disease processes that make oral care more difficult or put you at a higher risk. And many of those diseases show up in the oral cavity. So connecting the two, medical and dental, together is a very, very important aspect that we look at ensuring that we all come together for the best need of that patient. And then outreach communities. We see mobile clinics going out with teledentistry as well, providing the outreach and ability to reach those patient populations. Many times we see in the US, this will go for homeless populations as well, rural communities, smaller areas that generally don't have access to care. And then really provide not only that screening, but that patient education, which is a key component for changing the behaviors and changing the mannerisms of this patient specifically. So we're able to send those referrals to clinics as needed. I also see it with oral cancer screening clinics. They'll put on a mass screening clinic in places where they'll just go through and do an oral cancer screening, no other dental care. But at that point, they can capture images if suspicious and refer them to an oral surgeon as needed. And then school-based and preventative care. We see many, many hygienists going into elementary schools, providing school-based care. As I said, many children, are some of the most at-risk population. Early childhood caries we see. So we're going and providing care to these kids in the schools, at various schools. And teledentistry offers that ability also to loop in the parent. So you're going to the school, you loop in the parent and the dentist together and make the introduction between the two of them to get these kids care that they needed, and then make those referrals as needed. We often see great studies come out, like this one out of the state of California, where they looked at hygienists going into school-based programs. And they reached 85 to 90% of low-income children, and they were able to take care of 2/3 of their needs out of the office. This is all with mobile dentistry. So it is profitable. We've seen we can extend our hours. We can save money on our protective and our disposable equipment that we have to use. And it's a revenue generating aspect. Many areas you can charge for teledentistry services as well, but it lowers the cost to the dental practice. And in turn, it opens the ability to reach a new population of patients that maybe we had not seen before. And it opens the ability to get more patients into the practice. As I had mentioned, one 1/3 of dentists said that they were not busy enough. So are you busy enough, or do you want or have the capacity to increase your patient population? We can also reach out, again, as I said, and reach more of these patients moving forward. So there's real-time video visits, as we are now, which is our synchronous teledentistry. We have remote or asynchronous as well, where we can do more through the messaging through a secure patient portal. And that's that store and forward method. So moving on past that, are there any questions I can help answer?
Thank you, Jamie, for such an informative presentation. I would like to now hand back to Elizabeth for the Q&A session. Thank you, Elizabeth.
Thank you, Romilly, and thank you, Jamie, for a terrific presentation. I know I have lots and lots of questions, but before we start that, we do have a second survey question. As people are formulating their questions, we have another one for our audience, which is for those of you that do offer dental services. Do you currently offer teledentistry services? And that would either be a yes or no response. And if the answer is no, do you plan to offer these services in 3 months, 4 to 6 months, 7 to 12 months, more than 1 year, or not in the foreseeable future? So for the dental providers here, if you would please, do you currently offer teledentistry, yes or no? And if you answer yes, you can sit back for a moment. If you answer no, do you plan to offer these services? And if you do, when? So just take a moment, and if you would respond to our impromptu survey questions. This is simply for our information to get to know you better, who is participating in our web seminars, how might we be able to better meet your needs in terms of your expectations, and of course, in this regard to teledentistry. So if you do have some questions, you can type them into the chat box, and we will certainly look at those questions and share them with the audience. I'd like to start, if I may, Jamie, and as the host, I have the privilege of picking myself first. From your perspective, what do you see as the biggest obstacles to adoption of telemedicine services, both from the perspective of the dental provider and the patient? So we saw that the patient experience, people are happy, but what's preventing more people?
I think patients are probably a little more open-minded and acceptable to adopting this, to be honest, because they're finding the ease of use and really feeling like they're heard. Dental providers, we've been trained to see that dentistry is a hands-on, fingers in the mouth service. And by all means, it is. It is. And teledentistry doesn't replace that. It just provides a way to enhance your dental practice and really make it a little bit more profitable, as well as really streamline how you do it. I think personally that as patients are using telehealth more and more, and they're finding it, they're going to be demanding it more and more. And so they're going to be seeking it out. And those providers who are providing that as an opportunity are going to be the ones that are going to grow with it.
Great, thank you. So I'm looking here. I don't see questions from the audience, but I always have some. Um, let's talk about in the U.S. market, and I don't know if I'm sure this changes from country to country, but we see in the U.S. that dentists are, and not just dentists, but dental professionals are being impacted by COVID in terms of their career decisions. And
Right.
we see dentists and dental professionals are retiring, they're leaving the profession. In the US, dentists are older. So they reflect the population, the baby boom population. And as that segment of the population ages and people retire, dentists are now retiring as well, some influenced by the headaches and distress and stress of COVID, but others for, it's just time. So how can teledentistry help fill the gaps, or can teledentistry help the existing, or the people who are staying in the profession or just coming into the profession, use it to reach more patients? So how do we look at teledentistry and human resources and the availability of human resources?
Absolutely. I do know a lot of dentists that have chosen this time to say, I was close to retiring, so I'm just going to do it.
Yeah.
I do know dentists who are one foot into retirement, but not fully ready to leave. So as they're transitioning out, they're using teledentistry because they say, I can do this from home. I can do this from my vacation home. I can do this no matter where I'm at and still be able to reach my patients, still have some income, and still be valid within the dental community, or still be interactive within the dental community, but not have to be in their clinic 4 days a week. So they're finding it as an alternative. We're also finding new dental professionals that are coming into the market that are looking for an alternative way to do things. So they're adopting teledentistry as part of growing their practice. So whether they're able to be out and about, or whether they're able to maybe have part-time clinical staff if they're building it from the ground up, and then the rest of their time they're using teledentistry services, because really it only has to be the provider and the patient. You can use your support staff to scheduling to do any of that, but they're adopting it. I also see semi-retired dentists who are acting as supervising dentists for hygienists who have their own mobile dentistry practice. However, they still have to have some supervision. So they're using teledentistry to still work a little bit while they have a group of hygienists who are going out providing their own school-based programs, or going into nursing homes and their businesses. So they're using it as a collaborative agreement. I think it's going to, as I said, it's going to continue to grow by all means, and is going to do that.
Yes, I agree. I mean, we've seen it in healthcare in general, thanks to the pandemic, that whether it's telemedicine, teledentistry, that patients are just finding all of the benefits that you mentioned, the convenience, the safety, and so on, are just terrific features, and people are not going to want to give up the convenience. So I see we've got some questions here. So from your practical experience in clinics where we have more dentists, do the dentists see their patients, or is there a restructuring and some dentists are only seeing patients via teledentistry while others do the practical work? Oh, a new division of labor. Good question.
It is, and it depends. The beauty is you can decide however you want to do it. So I do know practices that only have a teledentistry dentist, and then refers them to the clinical, to the younger ones that'll provide the treatment that are still working. I do know ones that see only their patients per se. So it really widely varies, and it has the opportunity. And telemedicine is actually expected to be a $64 billion industry by 2025. So it's growing, and it's the fastest growing market of healthcare.
And that certainly is exciting and great for you. You are on the right road in the highway to the future. So another question we have, do you think there will be an official requirement for teledentistry soon or in the future, or is it something we need now?
I can only speak to the US market, and in the US market, there is no official licensure or addition on that you have to do. However, one state in our country has now adopted a requirement to take a telehealth provider continuing education course. And I actually presented one of those courses last weekend. We do have one at Mouthwatch, but what it does is it provides a course to everything from troubleshooting to protecting the patient's PHI to ensuring that you're going to be everything all around it. And it's built to certain standards. I can see states in the US starting to follow suit, but as of now, there's no special license required here. I think it's coming though. Not necessarily a special license, but taking an additional training for a couple hours.
And someone wants to know how they can apply for the course. So
reach out to me, Jamie, Jamie, and I'll put it in the chat, my email, and I will happy to let you know when our next one is coming up.
And you probably have that, excuse me, probably have that information on the Mouthwatch website, I would assume, which is just mouthwatch.com, as in Jamie's email address, so that you can learn more about teledentistry and the educational opportunities they offer. And speaking of education, I have a question about that and how to best leverage teledentistry for educational purposes. So, for example, when I go to my little dental practice and I'm done with the exam, the dentist says to me, you should do the following 5 things. Blah, 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 blah. Okay. And I get out to the parking lot and I have forgotten 2 of them. By the time I get home, I've forgotten 3 or 4 of them. And I find that there's not the follow-up. I need an email. I need a piece of paper. I need a message on my phone or something to reinforce those messages. So can teledentistry help with educating parents and patients as well?
Absolutely. And I've got a couple offices I work very closely with that are using it in very different ways for patient education, but finding incredible success. I have an office who is an orthodontist office, and they do a lot with myofunctional therapy, speech, changing that as well. And they found when they had to have the patients come in once a month, and they would look at the exercises they're doing and to follow up with them. And then when COVID hit, they took everything virtual. They did all their education, practicing everything, and they started doing it every couple weeks. And they found the results have multiplied. They're getting better results sooner, and more patient compliance. Same way with the periodontist office I'm working with. What they're using it for, and their typical program, is they would have an oral health education, make sure the patient is doing their oral routine, brushing, flossing, any additional interdental picks, and then reevaluating them prior to periodontal surgery, and they had to have certain metrics that they had to meet. They have now taken that, also doing virtual through teledentistry. And what they're having the patient do, they come in for the initial baseline evaluation, periodontal screening photos, and then the patient is uploading photos with their smartphone into the patient portal. Then they're meeting face-to-face like we are now and discussing the needs, the struggles the patient's having. And again, they're getting a great, great outcome with that. So they're finding a lot fewer of their patients actually have to go into surgery than they did before. And they were meeting the home care requirements necessary to do so sooner.
Excellent. Great. Excuse me. We do have another question. How accurate is the quality of images in diagnosing dental diseases?
There was a recent study that came out, and I wish I could remember it right off the top of my head, the percentage, but they looked at the accuracy of it was almost exactly the same as an in-person diagnosis. So it was within a couple points, accuracy-wise.
So what we haven't really looked at is the costs and the revenue models. As you said at the beginning, people think it's very expensive, and I'm sure that with that, I think that's correct, first of all. And second of all, that probably prevents people from doing some exploration because they just have no idea. Is it 5,000 or 50,000? You know, what are we talking about here? And how long will it take me to implement, get up to speed and start generating money, and then how long to pay it off?
Absolutely. I can only speak to our platform again, but you don't have to have an intraoral camera in the hands of every patient, which was the biggest misconception. Again, I have been completely blown away by what the general public can capture with the smartphone. They're pretty savvy.
Yeah.
So you have to have an internet connection, and you have to have a software. Ours were $109 a month for two users. So this may be the dentist and the hygienist if they're going remote. And you can add on additional users for just a couple bucks to that, couple dollars. And it really, when you look at the software in comparison to the patients that you're capturing that maybe wouldn't have come in, really 2 of those teledentistry appointments per month pays for that software in the US. So if I'm charging a $45 for a limited emergency exam, or $50, 2 of those a month is really paying for that software that I'm using. And realistically, that limited exam is going to turn into treatment for most cases. So that one patient that comes in that you use teledentistry with may be thousands of dollars worth of treatment in your practice. So the return on investment and even the savings with additional staff that you may have to have present if you were going to do in-office limited exam versus a virtual exam more than pays for itself.
Yes, and your point about the expense of PPEs.
Exactly.
So if you are saving on your PPEs by doing virtual visits in that way, it's expense saving. So it seems like a very solid revenue model.
Yep, expense saving and revenue generating all in the same. Absolutely.
Exactly. I'm looking to see, I don't think we have any more questions here. I, of course, do, but I want to be respectful of everyone's time. And I think certainly my interest in this subject has only grown. So thank you, Jamie. That's been terrific. And before I hand it back to Romilly to close out our session, I would just like to say that Of course, we are still living in the time of COVID, and that Temos has created a certification standards and a program that includes dentists. And the standards for the program, the COVID-19 SAFE program, are free to download to anyone, anywhere in the world. So, and there are standards that and guidelines for dental practices. We are already on version 3.0. So I would encourage you to go to the Temos website and look for those standards. All you need to do is register and download them. They're free. You don't need to pay for anything. If you would like to engage in the certification process, we would be happy for that as well. But the important thing is to get the information out to all healthcare, including dental providers, because yes, as Jamie said, our heads and our mouths are connected to everything else. So thank you. Thank you, Jamie. Thank you to our participants. And Romilly, back to you.
Thank you, Elizabeth. And again, thank you, Jamie. I sure have learnt a lot. And I would like to thank you all for attending today's web seminar. I hope you found it informative, as like I did. We look forward to following up with you, and you'll all receive an email with the link to the recording of today's program. I hope you all have a great day and stay well, everyone. Thank you once again.
Thank you.
Thank you.
Thank you all.